day and welcome to My Health, My Life, a program where your well-being takes the center stage. And every week on the show, we always bring you health conversations. We bring these health conversations closer to you. We break down the facts, we burst the myth, and help you to make smarter choices for your body, for your mind, and even your everyday life. And this is because health is not just about avoiding illnesses, it's about living fully, loving deeply, and showing up as your best self. So today I welcome you to the show and I say to you that relax, stay tuned, and let's take an important step towards a healthier living right here on My Health, My Life. The voice that you are listening to is the voice of Boluwatife Helen, your sweet radio voice, and I welcome you to the show today. Like you know that on the show we always have two segments. The first segment is where we either debunk a myth as false if it is false, and we claim it as true if it is actually true. And the second segment is where we dive into the discourse of the day, that thing that we have come to talk about, to converse about. And like I say every time that I'm behind the mic, I say that everything that we talk about on the show is important. The fact that it has made it to the show makes it important to be discussed. That is why it's on the show. And the topic that we're talking about today is already with me in the studio, same as the myth that we're going to be discussing about, we're going to be talking about. And this myth that I have with me in the studio, which is the first segment of the show, is something that we've been told over the years. Well, maybe not with the mindset that this is entirely bad, but then maybe with the mindset that they don't want us to do too much of these things so that it doesn't affect us the more. I think they're just trying to be on the safe side. That is why they have told us these things. And the myth that I have with me in the studio is that spicy food causes ulcer. This is actually not true. It is not entirely true that it is spicy food that causes ulcer. Some people will say when you eat too much spicy food, when you keep eating spicy foods, you have ulcer. Well, this is not true. If you have been told this while growing up, or somebody somewhere told you this, maybe just for them to stop you from eating spicy food, or maybe they know your condition, maybe you already have this ulcer before in the first place, so they are trying to help you, but they're not being entirely sincere with you. I think this is the case, because the thing that causes this ulcer is Helicobacter pylori. It's a bacteria that causes the infection that damage the stomach lining. And also the regular usage of non-steroidal anti-inflammatory drugs like your aspirin, your ibuprofen, and even other drugs like that can cause ulcer. So these are the things that cause the ulcer: the bacteria and the non-steroidal anti-inflammatory drugs that you use. These are the ones that actually cause ulcer. So if they're telling you that you should not eat spicy food, it's just that they're trying to protect you, because spicy foods can worsen the symptoms that you feel. This is what spicy food does. If you already had the ulcer, when you are consuming spicy food, it can worsen the symptoms. It can cause pain, it can cause irritation, and these things that it causes, it is in people that are sensitive. Normally, there is a compound in chili peppers that make food spicy. It has this protective effect. But in your case, if you're eating pepper, you're eating things that are spicy, and it is affecting you in a way, know that you already have ulcer, then your system is sensitive. The fact that you are eating this compound in chili pepper, which is normally supposed to have a protective effect, but it is triggering your own discomfort, it only means that you are a sensitive person. Your body is sensitive to it, your stomach is sensitive to it, and when you notice this sensitivity can come in the form of pain, it can come in the form of irritation, in people that are sensitive. So spicy food doesn't really contribute to ulcer. The only time that it can contribute or worsen the symptoms that you feel as an ulcer patient is when you are sensitive, your body system is sensitive. And if you are that kind of person, it is advisable to avoid spicy food so that you'll be able to manage these symptoms. So you need to avoid it. If you are the person that once you are eating spicy food, you feel some kind of things in your body, it means that you already have ulcer and your body is sensitive to this spicy food that you're consuming. So it is very good for you to avoid this spicy food. But if you're the kind of person that has ulcer and you're eating this spicy food and it's not doing anything for you, well, it means that that compound in chili pepper is actually working. It is doing the work that it's supposed to do. It is doing the protective work that it's supposed to do, so you are safe. But if your own is the other way, well, I would need to tell you that please avoid spicy food. And I hope you know now that it is not spicy food that you are eating that is causing the ulcer. It's because you already have the ulcer, but spicy food can worsen it if you are the sensitive kind of person. Your body is very sensitive to spicy food. So that is all today on the first segment of the show. We have debunked the myth that it is not true or it is not entirely true. Everything I've been told since growing up, or somebody have told you, maybe because they have noticed these things in you and they're just trying to help you, they're just trying to protect you. That is why they have told you these things. So it is not entirely true that it is spicy food that causes ulcer. The only issue about it is that it can trigger the symptoms of this ulcer that you are feeling if your body is very sensitive. Okay, so let's move into the second segment. If you just joined us, this is My Health, My Life, and the voice that you are listening to is the voice of Boluwatife Helen. And I'm also glad to tell you that you have missed the first segment of the show. And the first segment is basically where we debunk a myth as false if it is false, and we claim it as true if it is true. And this is the second segment where we talk about the discourse of the day. That thing that we have come to talk about on the show is what we talk about in this second segment. And please do not mistake these things. I'm saying that this part is not important, because this part and the first part, both of them are quite important. So none of the segments are unimportant. Now, moving on into the discourse of the day. The topic that we have on the table today is ulcer. Yes, we already said something about ulcer on the first segment, where we said that it's not spicy food that causes ulcer. It can only worsen the symptoms, and it is a bacteria that causes ulcer, and the bacteria is Helicobacter pylori. That is the bacteria that causes ulcer. Now, I'll have you know that ulcer is an open sore on either the external or the internal surface of the body. I don't know what you have been told about ulcer, or the kind of, well, I will not say hype that ulcer has received, but the fact that you can see it as an open sore, or you may not see it, it may be inside of you, but it's an open sore, makes it ulcer. And it is caused by a break in the skin or the mucous membrane, which fails to heal. So when there's this break in your skin or in your mucous membrane, and this break fails to heal, it fails to go back to its normal self, it fails to heal up, this is where we talk about ulcer. Now, I don't know if most people know that ulcer can happen both on your external and internal body, because I think the ulcer that we're used to is the one that happens inside of us. People don't know that ulcer can happen even on your external surface of the body. So ulcer is not only inside, it can happen on the outside too. And that leads us to the common types of ulcer. Yes, there are other different types of ulcer than the ones we know. There are different ones. We have the most common one that we know, the peptic ulcer, the one that is in the stomach or the first part of the small intestine. that is the one that we are so used to. So when somebody says ulcer, that's the one that pops in our mind, that oh, this person has stomach ulcer. They don't really talk about the other parts of ulcer. And peptic ulcer is not the only kind of ulcer there is. Well, but it's the most common, and it is a sore in the stomach lining or in the small intestine. This peptic ulcer, or this sore in the stomach lining or small intestine, it can cause burning abdominal pain, it can cause indigestion, it can even cause nausea. So when you are feeling like vomiting, or you are feeling an abdominal pain, you are feeling pain in your tummy, you sometimes when you eat food and it's not digesting, all of these things can be signs that you have peptic or stomach ulcer. And it is caused by Helicobacter pylori. It's an infection that is caused by this bacteria that damages the lining of the stomach. And other drugs that we use, I talked about the non-steroidal anti-inflammatory drugs that we use. So all of these things can cause stomach ulcer. So if the bacteria does not cause it, it means that the non-steroidal anti-inflammatory drugs like your aspirin, your ibuprofen that you are using can cause ulcer too. And the way you can treat this stomach ulcer is that you take your medication. You have to see your doctor. So when you take this medication, when they prescribe these drugs to you, you take these drugs, it helps you to reduce the acid in your tummy and also to kill this bacteria off. So you have to see your doctor, and now you know that peptic ulcer is caused by this and it's not caused by the spicy food that we talked about earlier. Another type of ulcer there is skin ulcer. Yes, there is skin ulcer, and this happens like pressure ulcers. You have some bed sores or diabetic foot ulcer. So that is skin ulcers. There is also mouth ulcer. We call it canker sores. And also there's corneal ulcers, and these are sores on the eye's surface. This is another kind of ulcer. So it is ulcer have some other place that it happens on. It happens on your mouth, on your eyes, on your skin, and then on your stomach or inside your stomach. And we talk about the symptoms of peptic ulcers or stomach ulcer. We talked about the pain, the abdominal pain, the burning, the pain that you feel in your upper abdomen. Sometimes you may feel bloated. Sometimes you might just be burping. You might feel full quickly. You might feel heartburn or indigestion. You might feel like vomiting, and sometimes blood or something resembling coffee grounds. When you have all of these symptoms, you know that you're already coming down with peptic ulcer. And people that are at risk of coming down with this peptic ulcer the most are people that smokers. So if you're a smoker, you are at risk of coming down with this peptic ulcer. Also, for people that have heavy alcohol use, they drink alcohol like they are drinking water, you have to cut down on that alcohol that you are drinking, because it can cause you to come down with ulcer. And for people that might have gone through chemotherapy or radiation, you can be at risk too. So if you are smoking, if you are kind of person that drinks too much alcohol, too much, you have gone through chemotherapy or radiation, and also you are age 65 and above, you know that you are at risk of coming down with ulcer. So all of these people that fall into this category are at risk of coming down with peptic ulcer. Now, another kind of ulcer that we're going to be discussing about is the mouth ulcer. Now, the mouth ulcer or canker sores are common. They are another common type of ulcer, and they are painful sores inside the mouth. They can be white, they can be yellow in the center, and they will have a red border. So when you notice these things, when you notice that some part of your mouth it has white or yellow center and it has a red border, then you know that this is a scenario of mouth ulcer. And this mouth ulcer can be caused or triggered by injury. Maybe you accidentally beat your cheek, or for people that wear braces or you eat raw foods, when you have these issues, when you have these scenarios, you can come down with mouth ulcer. Also, nutrient deficiency can cause these things. When you are eating food that doesn't contain some kind of nutrients, or when you lack some nutrients like your B vitamins, your B12, or you lack some minerals like your iron, your folate, all of these things can cause mouth ulcer. Also, stress and hormones. Stress and hormones can trigger mouth ulcer. So when you are emotionally stressed or there's hormonal shifts in you, it can cause mouth ulcer. And the kind of food that you eat, when you eat too much acidic foods like citrus, tomatoes, then spicy foods can trigger these too. Or you eat salty foods or abrasive foods, food that are so rough you just have to just munch and break down, and your mouth be doing crum crum crum. It can injure when you eat some kind of food that are too hard, it can cause injury in your mouth. And that's why we talked about raw foods. Also, when you take too much of acidic food, it can happen. Too much of salty food can happen. When you take spicy food, if you are the kind of person that you already have these things, you may not know, but because you took spicy food and your body is sensitive to the spicy food, it can just pop up. That's when you now notice that, oh, I feel this sensation in my mouth, this thing is peppery. Oh, what happened? Oh, I feel this part of my mouth peppering me. Yes, at that point it has triggered it to show up. It is there before, but because you've not eaten something that will bring it out, but the point that you eat that spicy food, it brings it out. So at that point is when it is triggered. Also, for underlying conditions, when there's underlying conditions or reduced saliva in the mouth, it can cause mouth ulcer. And other causes of mouth ulcer can include some certain medications. You see that everything comes back to the medications where we talked about earlier. Also, smoking. That's why I said that if you're a smoker, you have to cut down on your smoking, and even if you can stop entirely, that would be very good. So some kind of medications can cause it, smoking can cause it, or you use abrasive toothpaste. Your toothpaste is too rough, it's not smooth, or you are not even supposed to be using them. All of these things can cause mouth ulcer. And when there is mouth ulcer, or when you have mouth ulcer, what do you see? You find out that you have painful round shaped sores. You see them in your mouth. They have this white or yellow center and their border is now red. So when you see that kind of a thing in your mouth, you already know you have mouth ulcer. It can appear on your lips. It can appear inside the cheeks. It can appear on your tongue. It can appear on your gum. It can appear on the roof of your mouth. So when you see all of these things at this place that I've mentioned, then you know that you have come down with mouth ulcer. And when you find out that to eat is not comfortable, you cannot eat well, you cannot drink water well, you cannot even talk well, all of these things, when you are just trying to manage yourself and you find out all of these things are happening, you cannot eat, you cannot swallow food, to drink water is not possible, it's making you feel uncomfortable, and talking, you know that you have come down with mouth ulcer. And when you see these things, how do you treat it? How can you treat mouth ulcer? You can rinse your mouth with warm water that has salt. You can just put a little salt inside the warm water and rinse your mouth with it. You can apply honey to these surfaces, the place where you feel it, on your lips, on your tongue, on the roof of your mouth, on your gum, inside your cheeks. You can apply honey or aloe vera to this place, or you can use coconut oil on this place. Also, the way you can manage it is that you should avoid irritants. Anything that would cause it to be triggered, you have to avoid it, like spicy foods, acidic foods, salty foods, or even hard foods. You have to avoid them. And if it is possible, you can use gels and antiseptic mouth washes. pending the time that this thing will be able to heal. Because imagine that you are brushing with your hard or even the so-called soft brush and you have this mouth sores, you know that it's going to be affecting these things the more. So for the meantime, for the time that you'll be able to heal, you can just use gels or antiseptic mouthwash to do your normal oral routine. Also, you have to maintain good hygiene. Use a soft brush if needed. So for you not to come down with this mouth ulcer that we have talked about, be careful of the brush that you use. We said earlier that abrasive toothpaste or rough toothpaste can cause it. If you are using hard brush on your mouth, hard toothpaste on your mouth, you know that you are at risk of coming down with this thing. So you have to maintain good hygiene. Brush your teeth twice a day, at least twice, in the morning and the night before you go to sleep, and use soft brush. And there are some times that it goes beyond the norms and you have to see your doctor. So when you notice that this thing is going on for more than 2 weeks, it's already 2 weeks, 3 weeks, 4 weeks, you know that you need to see your doctor. And if you notice that this thing is unusually large or is near your throat, of course, we talk about it affecting how you eat, how you drink, or how you talk. But you just know that this thing is moving or is expanding. Probably was on your tongue before, but it's spreading to near your throat. You need to see your doctor. And you know that this thing bleeds and it becomes very red, redder than it used to be, or it shows signs of infection. You have to see your doctor. And if you have other symptoms aside pain that you feel on the part that you have the mouth ulcer, probably you have fever or you have diarrhea, then you need to see your doctor, because at that point it means that it has gone beyond the norms, it has gone outside of the norms. So you need to see your doctor at that point. So I hope that you have learned one or plenty today on My Health My Life, where we talked about ulcer, we talked about spicy food not being the cause of ulcer, but the bacteria Helicobacter pylori and the non-steroidal anti-inflammatory drugs that we use. And where we talked about the different types of ulcers, we talked about the peptic ulcer, we talked about the skin ulcer, we talked about the mouth ulcer, we talked about the corneal ulcers. And we said that ulcer is any break or open sore on the skin, on the mucous membrane, either the external or internal surface of your body. I've talked about how you can treat these ulcers. So we talked about if you have stomach or peptic ulcers, you take your medications so that it can reduce the acid in your body or your tummy and kill the bacteria. I talked about the risk factors, where we said you need to cut down on smoking, cut down on drinking alcohol, and live a better life. And also talk about the mouth ulcer, that this one can happen in the mouth, on your tongue, your cheek, your gum, and comes with a yellow or white center with a red border. And if you notice that it's becoming more than it should, is lasting for 2-3 weeks, 4 and beyond, you should see your doctor. So this is all today on My Health My Life. Till I see you again next week, Tuesday. Enjoy a beautiful and a fruitful week. Bye bye.